Did you know that 70% of bunions come back after traditional surgery? I want to tell you about a revolutionary procedure that lets patients walk within days instead of weeks. But there's a surprising reason why most doctors aren't talking about it. I'm Dr. Andrew Schneider, and after performing hundreds of bunion surgeries, I've discovered something that might shock you. Most bunion procedures are treating the wrong problem. Think about it. If you had a leaning tower, would you just shave off the part that's sticking out, or would you fix the unstable foundation? Traditional bunion surgery is like putting a band-aid on a broken foundation, and that's why 7 out of 10 bunions can come back. But today I'm going to show you a revolutionary 3D approach called Lapiplasty that's changing everything. Not only does it correct the real cause of your bunion, but my patients are walking within days, not weeks. Before I show you how it works, you need to understand these 3 critical things about your bunion that most doctors never mention. Hi, I'm Dr. Andrew Schneider, and I'm a podiatrist in Houston, Texas. Let me explain what's really happening with your bunion, because it's not what most people think. First, your bunion isn't just a bump on the side of your foot. It's actually a complex 3-dimensional deformity. In fact, 87% of bunions involve bone misalignment in all 3 dimensions. Think about it like this. Imagine your first metatarsal bone as a tall building. In a normal foot, this building stands straight. But with a bunion, this building isn't just leaning to the side like the Leaning Tower of Pisa, it's also rotating and lifting up. That's why simply shaving down the bump, which is what many traditional surgeries do, doesn't fix the real problem. Let me break down these 3 dimensions in details. First, there's the transverse plane, the sideways lean that you see when you look down at your foot. Secondly, there's the sagittal plane, that's the elevation or lifting of the bone. And third, there's the frontal plane, that's the rotation of the bone, which affects how your toe touches the ground. Traditional surgeries typically only address 1 or 2 of these dimensions, leaving the third uncorrected. The second critical thing you need to understand is that bunions start with an unstable joint in the middle of your foot. This joint is called the first tarsometatarsal joint, and it's like the foundation of the building. When it becomes unstable, it allows your metatarsal bone to drift out of position. Traditional surgeries don't address the unstable foundation. They just try to realign the top of the building while ignoring the shifting foundation below. And here's the third crucial point that most doctors won't tell you. Because traditional surgeries don't fix the unstable foundation, there's a 70% chance your bunion will come back. Think about that. You go through surgery, deal with weeks of recovery, only to have your bunions return months or years later. That's where Lapiplasty is different. Instead of just shaving down the bump or making a cut in the bone to shift it over, Lapiplasty addresses all 3 dimensions of the deformity and stabilizes that unstable foundation joint. It's the first and only procedure specifically designed to correct the entire deformity at its root. Let me explain exactly how it works. Using advanced instrumentation, we can precisely rotate and realign your entire metatarsal bone back to its normal anatomical position. Then we use specialized titanium plates to permanently secure the correction. This technology, which has been published in the Journal of Foot and Ankle Surgery, provides unprecedented stability. The difference between traditional bunion surgery and Lapiplasty is dramatic. In traditional surgery, the surgeon typically makes a cut in the bone and shifts it over, sometimes securing it with a single screw. This approach doesn't address the rotation of the bone or the unstable foundation joint. With Lapiplasty, we use 2 titanium plates to provide stability in all 3 dimensions, much like having multiple support beams in a building instead of just one. Let's talk about recovery in detail. Because of the advanced fixation techniques used in Lapiplasty, most patients can begin walking in a surgical boot within a week after surgery. This is possible because the titanium plates provide such stable fixation that early weight bearing won't compromise the correction. During the first week, you'll need to keep your foot elevated when not walking and use ice to control swelling. From weeks 2 through 6, you'll gradually increase your walking time while wearing the surgical boot. You'll also begin gentle range of motion exercises to prevent stiffness. Around week 6, most patients can transition to supportive shoes. This is much different from traditional surgery, where patients often need to avoid walking for 6 to 8 weeks and may not return to regular shoes for 3 months or more. By week 12, most patients have returned to their normal daily activity. Full recovery, including return to high-impact activity like running or jumping, typically occurs around the 4-month mark. Throughout this recovery process, we'll monitor your progress with regular x-rays to ensure proper healing. Postoperative care is crucial for long-term success. We'll provide you with specific instructions for wound care, swelling management, and activity progression. You'll learn exercises to maintain joint mobility and prevent stiffness, and we'll also discuss proper footwear choices to protect your correction and prevent future problems. Long-term success with Lapiplasty depends on following proper postoperative protocols and maintaining good foot health practices. This includes wearing supportive shoes, maintaining a healthy weight, and addressing any underlying biomechanical issues that might have contributed to your bunion formation. Prevention of complications is another crucial aspect of bunion surgery. With Lapiplasty's stable fixation and precise correction, we see fewer complications compared to traditional procedures. However, it's still important to follow all postoperative instructions carefully to prevent issues like infection, delayed healing, or stiffness. The long-term benefits of Lapiplasty are significant. Because we're correcting the deformity in all 3 dimensions and stabilizing the unstable joint, patients typically experience permanent correction when the procedure is properly performed. This means no more pain, no more difficulty wearing shoes, and no more worry about your bunion coming back. But timing is crucial. The longer you wait, the more damage can occur to your joint. Over time, bunions lead to arthritis, hammer toes, and other foot deformities. They can also affect your gait, leading to knee, hip, and back pain. That's why it's important to address the problems before these complications develop. Thanks for taking the time to watch this video. I've written a comprehensive guide about bunions and their treatment that you can get for free at www.bunionbook.com. This book explains everything you need to know about bunions, including traditional and modern treatment options. Take a moment to like, comment, and share on social media. Be sure to hit subscribe so you won't miss another video. If you're concerned about your bunion and you want to learn about Lapiplasty and see if it's right for you, come into the office and we'll evaluate your condition. That link is in the description. Thanks so much for watching, and have a great day.